everyone. I'm going to talk to you today about my apprenticeship as a dental nurse. Firstly, I'm from Australia. I've lived there for 8.5 years and I completed a diploma of enrolled nursing. When I came back, I decided that nursing wasn't for me anymore through family issues and things like that. So I decided to go into dental nursing. I've been at stationary dental practice for over 2 months now and I really love it. I couldn't think of doing anything else now. I applied through, well, my brother actually. My brother noticed a sign in the window of stationary dental practice and he was quickly on the phone to me saying, you need to apply, it's perfect for you. So I did exactly that and I went in and I applied, and within half an hour I had a phone call asking me to come in for an interview, which I went for an interview 2 days after and got offered the job there and then. Other ways to apply for said position would be online at findandapprenticeship.gov.uk, or you can just go in and hand your resume in if you see someone advertising for a dental nurse. What's involved in my job? My job is really stressful. So many things to do. It's a very busy practice and the practice consists of 5 hygienists and 8 dentists. I work 42 hours a week. I start at 8:30 and I finish at 7. On a Friday I finish at 5:30, that's when the surgery closes. And I get 1 hour for lunch. But all the time I'm on my feet and it's very, very busy. My apprenticeship's going to last 2 years in total. I've only done 2 months so far, but I will be finished and be a qualified dental nurse by summer next year. When I get to work, I check my day list for the day, see what I've got in, make sure that I've got all of my, whether I'm having a crown fit, make sure I've got my crowns ready, just get myself as organised as possible for the day. Got to clean everything, surfaces, lights, light fittings, everywhere. Make sure that we've got gloves and goggles at the ready, because obviously we need to wear our personal protective equipment every time that we are dealing with a patient. I then log on to the computer software where I do all my charting. We do BP charting, which is basic periodontal examination, so checking the pocket depths of patients. I set up all my water lines, I replace my water bottle. At our surgery we have, it's called the dark room, which we keep like all the casts and things like that. It's also got the sterile water. That's all that we put in our water bottles, which goes into, like, when they use a fast headpiece, the water comes out and that's just sterile. I prepare the detergents and sterilisation liquid for the instruments and impressions to go into. Other than that, I'm pretty much ready to call my first patient. Our aim at stationary dental practice is to provide high patient care and assist dentists with all their requests, and provide post-op instructions when we've removed a tooth. Responsible for decontamination of instruments. So at my practice we don't normally have a decon nurse, which is a decontamination nurse. There's a specific room where we decontaminate all the instruments. It goes through an ultrasonic bath, or we scrub them first, then it goes through an ultrasonic bath, and then they get put through an autoclave, which goes up to 135 degrees. Then we bag them in sterile packs, and then they go off to the different surgeries. As an apprentice dental nurse, or any dental nurse really, we can be in charge in the decon room. There's not an assigned person who does it. Duties can include the examination charting, the periodontal charting. I do lots of crown preps, crown fits, impressions, aspirating, preparing fillings with different filling materials, which is amalgam, composite and glass ionomer, and assist with extractions as well. They're my favourite. I don't know whether that's because I like seeing people in pain or whatever. Also, we do some cosmetic procedures at Station Road. Do Invisalign, one of our dentists does the Invisalign. It's $3,450 for a full upper and lower aligner. I've seen some amazing results from it, from people coming in. They've got a software that the dentist uses, and just to see the change from where the person has started to the end result, or in between even, and they're so happy, is just amazing. Also, we do teeth whitening. It'll be £350, which includes your top and bottom whitening trays. They get made in the lab, and then you come for a review, and you get given a polar light tray set with syringes in there, and you get told how to put them in the trays and how to fit them, how long you should keep them in for. Most people, they put them in for anywhere between half an hour to 4 hours they can stay in for. It's very unlikely that you can get sensitivity from it, but I'm going to give it a try. I've got my review coming up, so I'm very keen on giving it a go. Obviously you get staining from your drinks, like your tea and your coffee and things like that. So a lot of people come in and they're obviously not happy with their appearance of their teeth, so they decide that teeth whitening may be the perfect option for them. It's the #1 cosmetic dental procedure worldwide, and offers maximum benefits when used as part of a smile makeover treatment plan, such as maybe you had your Invisalign and then you decided to have your teeth whitened. You have this celebrity smile that everyone dreams of. So yeah, if you're not happy with the appearance of your teeth and they've become discoloured from drinks such as tea or coffee, certain foods that you eat may have stained your teeth. Also, red wine and smoking is one of the big main reasons why our teeth stain. Then whitening can make you have a younger appearance with your teeth. I would highly recommend it to anyone who feels their self-esteem is being affected by it, and definitely if you're interested, go and speak to your dentist about it, and they'll be able to give you more information on it. But if I'm still here and I have it done, then I'll show you my results from, I'll take it before and after I've done it. So yeah, I've also got some brochures to show you. Just about veneers, crowns, bridges, also a brochure about tooth whitening, dental implants, and yeah. So I'll pass them around. You can have a look.
When you talk about top and bottom trays, what does that mean?
I say you'll have an impression taken of
right.
your upper and your lower. Sort of similar to if you were having like a denture made.
Right, yeah.
And they'd take your impressions into the lab, and then they'd make a tray that would suit your teeth. And yeah, then you just fit them like your normal retainer. The retainers are pretty much like the Invisalign picture that you saw. They've got a bit of a lip around the top of them. So when you put the polar light gel in them, it doesn't seep over the top.
So that is put on the top of your own teeth?
Yeah.
Oh, right. I didn't know they got the same one.
So yeah, so you fit the retainer on, you kind of push it onto your teeth, and your teeth sit in it.
So they're not wiping your own teeth, it's like a cover.
No, like it whitens your own teeth, but it's a plastic that goes over the top, and then you take it off. We recommend brushing before you do it, in case you've got any like debris in between your teeth, and then brush them afterwards as well. We've also, when you get the polar light, you get kind of like a little brochure with it. and you tick where you think that your teeth are on this scale and where you want your teeth to be. So you can see how you get on with it. And then we normally recommend patients come back about a week after giving it a try to see if they're happy with the result. If they're not, then we can tell them to put more gel into the trays to get a whiter smile.
Right.
Yeah.
So, what do you feel about an apprenticeship in dentistry then?
I
Do you
love it.
recommend-
You can do a diploma or you can do an apprenticeship style. The girl that I work with, she's doing a diploma, but that was because she'd already got a qualification before that, which enabled her to get the diploma. I think doing it as an apprentice, it's hard work, and you feel like because you're on a low wage, you feel kind of like you're their little run around and you're doing everything. But at the same time, doing it on the job, I don't think you could do it like any other way that was better than that, because you're there with the patient every day and you're learning so much. Whereas if it was, just basically textbook, then you wouldn't have that experience. Because when I want to go on to do my hygiene therapy once I've done my dental nursing for a while. I want to do my radiographs and also then do my hygiene therapy. So when you go to apply for uni to do hygiene therapy, they look back to see whether how much experience you've got as a dental nurse and how many other things you've got. And if I've got all that to throw at my uni degree, then I've got more chance of getting it. And I'm finished.